Hi everyone, Buki Ademola here with you. On this platform, I'll be sharing some tips on OET speaking for nurses. Just in case you're not familiar, occupational English test is designed specifically for healthcare professionals to assess how proficient they are in using English as a communication tool. But the focus for now is on speaking. The speaking role play takes an average of 18 to 20 minutes. You have 3 minutes for the warm-up session. The warm-up session is not part of your assessment, meaning the warm-up session will not be assessed. You have 2 role play. Each role play will take an average of 5 minutes each. And you have 3 minutes to get yourself prepared for the role play presentation. So in total, you have an average of 18 to 20 minutes. The focus for now is on the assessment criteria. We have 2 major criteria which will be assessed as regards your speaking. The first one is the linguistic criteria. The linguistic criteria is subdivided into 4 groups. We have intelligibility, fluency, appropriateness, and resourcefulness of grammar. On the intelligibility, we want to take it one after the other. Intelligibility has to do with your ability to communicate in a clear language. The pronunciation must be clear enough. Your voice and pronunciation must give room for understanding. It's all about the ability to be understood. Your accent must not obscure the understanding as regards the information you are trying to pass across. Now let's go to the next one, which is on fluency. Fluency is about the ability to communicate smoothly with less hesitations. What do we mean by hesitations? Hesitations has to do with when you have to use the sound like I mean, your flow of speed must be smooth, not too fast and not too slow. That is what fluency is all about. You must give room for understanding as regards whatever information you are passing across to your client. The next one on appropriateness, the ability to listen actively and respond appropriately. Try as much as possible to use simple terms suitable for your subject. What do I mean by your subject? You put into consideration the age of your patient. At times, you may have to do a role play as regard a pediatrics. Avoid using medical jargons or ambiguous language. Try to make it as simple as possible. Make use of emotional intelligence and apply correct tone and volume to reflect empathy. What do we mean by that? For example, your patient complains of a severe pain. Oh, I'm feeling so much pain on my hand and it's so difficult to move this hand. What should your response look like? Oh, I'm sorry about that. We'll see what we can do to relieve your pain. That's what we mean by reflecting, let your tone reflect empathy. And the last one, on the linguistic criteria, don't forget, is on grammar resourcefulness. Apply the use of range of vocabularies. Apply paraphrasing to avoid repetition of words. Correct use of your tenses, simple, present, and past tense. That is on linguistic criteria. Now, the second criteria to be assessed. We're going to look at the clinical communication skills. Clinical communication skills. Your approach to this can be with a sense of purpose, compassion, curiosity, and empathy. Now we want to take it the subgroup under clinical communication skills. Number 1, your relationship building skills. Be friendly. Do a self-introduction. Make your purpose known. Be respectful, courteous, and give rapt attention to your patient or client. Be sensitive to your patient's reflections and feelings, just as we talked about empathy in the beginning. The second point on clinical communication skills is understanding your patient perspective. Remember your assessment skill as a nurse. Good history-taking skills is required or needed in this regard. You can address the following question. Why is the patient here? What is the main problem or feelings at this point? What is the challenge confronting your patient sitting with you that needed a counseling at that point in time? Do not monopolize the talking. Fine, you are the healthcare professional, you need to give a counsel to your patient, but don't do the talking alone. Give room for response. You can apply summation technique to reinstate or review the information received, just to test for clarity and understanding. The third point on clinical communication skills, we're going to look at the structure, providing a good structure in your approach. In this aspect, be systematic in giving the needed information, advice, or counseling to your patients. Try as much as possible to follow a chronological order to explain procedures. For example, you can approach it in this way. To start with, next, then, in conclusion, or to conclude. That is what we mean by using a language order. Or you can approach it in this manner. Firstly, I want to tell you about this. Secondly, thirdly, and lastly. The next point, still on clinical communication skills, information gathering approach. Your approach to asking questions. Try as much as possible to apply open-ended questions in this regard. Non-directive questioning method. This will give room for your patient to be able to express their feelings. It will give you a deeper insight at what is the challenge or problem your patient is encountering. And this will give you a right approach as regards your intervention as a nurse. And lastly, we are going to look at information given. Try to convey understanding as regards necessary and required information. Try to get a feedback by giving room for questions. Try to conclude the session in a comfortable manner, a comfortable approach. This is all I'll be discussing for today. So if you like this lesson, if it is helpful, please click like on the button and subscribe to this channel. I wish to come more with more tips that will be helpful as regarding your OET speaking. Bye for now.